Good evening, everyone. My name is AJ and I'm with End Overdose. So today we're going to be covering how to identify and respond to an opioid overdose. Now we're going to do this in 4 steps. Okay, now step 1, we're going to recognize the signs and symptoms. Now the 3 I want you to pay attention to are on this board right here. Now this is also known as the opioid overdose triad. Now these 3 signs and symptoms are pinpoint pupils, shallow breathing, unconscious and unresponsive. Now pinpoint pupils, a lot of us have a light source on our phone, right? Now, if I check these pupils, a normal reaction to light is, they'll react, right? They're going to be reactive. Now, if this person is experiencing an opioid overdose, if I check these pupils and they are non-reactive to light and pinpoint, that's a bad sign. That's also known as meiosis. Now, we're also going to check for breathing. Now, a typical adult breathes 12 to 20 breaths per minute. Anything under 12 breaths a minute is considered respiratory depression. Now, to check for breathing, we're going to stop, look, and listen. So we're going to tilt the head back. We're going to look at the chest at an angle. By doing so, I'm better able to see the chest rise and fall. Not only that, I can hear for a breath and feel for a breath. So anytime they exhale, it'll be warm on my skin. If this individual is breathing under 12 breaths a minute, they're in respiratory depression. Now, we're also going to check responsiveness with the sternal rub. You're going to get your hand ball in a fist. Now, your knuckles, you're going to grind on the sternum like a washboard. If this individual is unresponsive to the stimulation, right, that's a bad sign. If these 3 signs and symptoms are occurring, this is also known as the opioid overdose triad. This individual is experiencing an opioid overdose, okay? Now, step 2, we're going to call 911 or yell for help. In California, you're protected by the Good Samaritan law. This protects you from any civil damages. Now, this law also protects the individual who is under the influence of a controlled substance, in possession of a controlled substance, and in possession of drug-related paraphernalia. Do not be afraid to call 911 and get help on the way, okay? After we call 911, step 3, we're going to administer naloxone, right? Now, naloxone is the medication that they use to reverse an opioid overdose. Real simple, real easy to use. This is an intranasal device. You're going to hold the device like so. 2 fingers up top, thumb on the plunger. You're going to insert in the nostril as far as the fingers let you, and you're going to hit the plunger once, okay? Now keep in mind, a real device is one-time use and done. Once you use it once, you cannot use it again. Step 4 is continued care. After we administer the medication, we want to start rescue breathing. We want to clog the nose, tilt the head back. We want to give this person a breath every 5 seconds, okay? Every 5 seconds. Now, if it hits 3 minutes and they are still unresponsive, administer a second dose in the opposite nostril and continue rescue breathing. Now, in the event that this individual starts to become responsive, which is a good sign, we want to turn them on their left side in the recovery position. The reason for this being is they might be nauseous, they might throw up. This prevents them from choking on their vomit. There's no life-threatening side effects of this medication. If you misdiagnose somebody, no harm, no foul, they'll be perfectly fine. Thank you for taking our training.